Good afternoon. I'm Dr. Bruce Sadlick. We're going to do a little bit more of upstream medicine and specifically talk about post-COVID, aka chronic COVID, and some treatments. The most important thing, we discussed this last time, but we'll make it a little bit more concise this time, is get a complete laboratory serology, such as a CMP, which would be a complete metabolic panel. Get a CBC, which would show your white and red blood cells. And then another good lab to get would be what's called a CRP, which would be a marker used to check for your inflammatory patterns. COVID unfortunately does affect some of the vasculature, so a CRP would be a beneficial test. Vitamin D, get that level checked. We talked about this last time. You don't want to have too much, you don't want to have too little, so there's a fine line. So get that checked and make sure that's within the normal ranges. Specific nutraceuticals, botanicals. Uh, Aim for, if you can, your zinc. You may have enough of it in your multi. So zinc, about 30 milligrams, could be very helpful and beneficial to the immune system itself. Quercetin. Quercetin is basically look at it as an anti-inflammatory, works on multiple pathways. It can be helpful for the GI system. It can be helpful for prosthetic issues. It provides a blanketed anti-inflammatory effect. So look at your nutraceutical botanicals, see if those have it in it. B complex, post-COVID, aka chronic COVID, does take a lot of the stress, and the stress vitamins themselves get depleted. So look at doing at least a B complex, a B/50 or a B/100, because that will help put those what we call water soluble supplementation back in. If you don't have a multi, consider a plant-based multi. Many are out there. Metagenics has a couple, and the other nutraceutical, botanical, pharmaceutical grade companies have some. Remember, look at how many milligrams of vitamin D are in the multi versus how many milligrams of vitamin D you need to use. And same with zinc. It's a cumulative effect. So you may not need more than you already have. Vitamin C, minimally aim for about 2 grams. By utilizing some of the fat soluble Cs, they'll be in the system longer, and that can benefit the immune system. If you have ascorbyl, use what you have and then try to aim for a different type. Ascorbic acid, ascorbyl acid, 2 different types of vitamin Cs. Look at what you have and try to utilize that. Remember, intravenous infusions, they can help supply you with nutraceutical botanicals that you may not be able to absorb or may not be able to get enough of. IV infusions can be very helpful, especially if when you did have COVID, you ran kind of what we'd call chronically low-grade dehydration. Nutraceutical botanical IV infusion, even IV fluids, can be very helpful to make you feel a little bit better. If you have any further questions or you need any further advice, just feel free to give us an email, drsadlick.com. Check the website out and let us know if we can help you from there.